Today's webinar, Interpreter Certification and Skill Maintenance as Key Elements of Quality Assurance, we present because we feel it's very important for CCHI as a certifying entity to have a conversation with language service providers, be it for-profit or non-profit companies and agencies. And we just want to touch base and talk together of how we can work together to make the quality of interpreting services for hospitals and for patients better over time. Just again reminding you that you can type in your questions in your control panel where the arrow is pointing right now. So I want to start with a couple of quotes and facts to kind of ground ourselves in today's conversation. First, from The Economist this February, the business of translation, interpreting, and software localization generates revenues of $37 billion a year. And another quote is a recent one from Career Builder, who published just this June a study which shows that interpreting and translating services are forecasted to add over 12,000 jobs in the United States in the next 5 years, which is a 36% increase compared to 2014. The obviously positive information from these quotes is that we are an important industry. However, there is a little bit of bittersweetness to it. As you see, we always in studies of that nature are combined with translation industry and with software localization industry. And we can deal with this fact two ways. We can either accept it and just build our work around the understanding that the world will always perceive interpreters as part of a larger language industry, or we can try to do something to make sure that interpreting is recognized in studies and is a separate line in this kind of reports, but also the subset that we are interested in today, the healthcare interpreting, also has a presence in the economic world, because we all know if there is no economic foundation to certain industry, it really cannot exist. And another set of facts, just to ground us in the understanding where we are as a healthcare interpreting profession today in terms of national certification. I took this data from both organizations' websites, so take it at this value. I obviously can speak to CCHI's numbers, and we're very proud to have almost 2,000 certified interpreters as of yesterday. You see, I checked the data yesterday. So in this webinar, we'll first talk about the quality assurance process as it relates to the interpreting industry and healthcare interpreting in particular. I'll give you obviously the overview of CCHI certification program and its components. We'll talk about interpreter skills maintenance and importance of it, and at the end talk how we can work together and how, if you include CCHI as a thought, at least in your quality assurance process, you can see it being more relevant and see results. So what is quality assurance? If we check Wikipedia, our biggest expert on everything right now, well, competing with Google, quality assurance is a way of preventing mistakes and avoiding problems when delivering services to companies. And if we talk about our industry, it means that we want to make sure that the interpretation delivered is accurate, complete, and takes into account all cultural aspects of it. And also avoiding problems with customers means that interpreters are able to communicate as equal professionals in the care team, meaning with healthcare professionals, doctors, nurses, technicians who provide care for the patient, and also are able to communicate effectively with the patients and bridge the gap which exists in communication between patients and healthcare providers. So that's what quality assurance really means for healthcare interpreting. If we look at this cycle of quality assurance, roughly 4 steps. You plan or analyze how you're going to make sure that your interpreting services are of acceptable quality. Then you implement the services and deliver them with the intent to have the best quality possible. Afterwards, you check or evaluate your performance, and then you act upon the findings of that evaluation, and which, these actions again inform the planning of delivery of services again. So it's a circle, it's an iterative process. We go through the steps multiple times because the industry we're in is very complex with many players, and there will never be a finite moment and you say, now I have everything in place for my quality assurance, and I know all my interpreters are doing an excellent job and there are no improvements necessary. Let's take a look at each of the steps of the quality assurance. So the planning stage, the planning of the quality assurance process. How do you know that the services you're delivering to hospitals or other healthcare providers actually are of high quality? Well, first, you need to know industry standards. And this is something different than was 6 years ago when there were no national certifications available in this country. Then part of your planning is obviously your recruitment strategy and then workforce development. There are other aspects, but I'm just trying to look at the bigger picture points which coincide, whose relevance is of the same importance for language companies and agencies and for the certification body as CCHI. So as far as the industry standards, obviously your planning needs to be based on the knowledge, and knowledge should include your knowledge of CCHI national certification requirements. And that's why today I will go over these requirements and the components so you can include that into your planning process. The recruitment strategy obviously has many aspects, but one of the things to consider is developing the payment scale that depends on the interpreter's credentials, because again, 5 years ago, you didn't need to think about that in your quality assurance process. Now you do, because how would you attract people who are already certified? How would you attract people of real languages that have CoreCHI certification? Many things, including differential pay scale. Workforce development, yes, you can have your best recruitment strategy for attracting a new talent, but you still need to work with the interpreters you already hire or contract at this moment. So your quality assurance plan should have a plan for how they're going to meet the national certification standards. And here I want to say that we have heard from many language companies and hospitals who hire interpreters who actually build in their process some timeline for interpreters to get certified. So before I move further, I would like to ask you a question. On your screen, you see the poll question. What is your human resources or HR position regarding national certification? And please make your choices. You can select multiple answers. So the options are: we prefer all new applicants to be certified. We require all new applicants to be certified. We require all new Spanish applicants to be certified, just in recognition that most interpreting services have Spanish as the main requested language. And we plan to require all our interpreters to become certified. So those are your options. And I see we about have 76% who voted. Just let me give you a couple of seconds, and then I'll close the poll and share the results with you. All right, thank you. So here are the results. I'm very impressed that the majority of attendees on the call, and just right now we have about 21 representatives, 67% of you prefer all new applicants to be certified, and that makes perfect sense. You know, why not take advantage of this opportunity? 17% require that. That is really great from our perspective, 6% require all new Spanish applicants to be certified, and 50% plan to require all of your interpreters to reach certification. This is very good, news, and it kind of aligns with what we've heard at talking in to different language companies and talking to interpreters at conferences, because many of them write to us and ask, well, my employer, my company asks me to get certified. How can I do it quicker? And that is something we definitely want to encourage. And I apologize, there's a little pause in my presentation, so you probably, it'll take a second for me to make sure that you see my screen. All right, the next step of the quality assurance process is actually implementing the services of high quality. And here there are many components, but again, I'll just focus on 4. Your hiring practices, working conditions, documenting performance, and workforce development again. And if we talk about the hiring practices, and as we saw in the poll, the majority already recognize the fact that it's much easier and efficient to hire CoreCHI CCHI certified interpreters. Another aspect to consider is to allow specialization for your interpreters. Broad, like health certified interpreters, or court versus court certified interpreters, but also narrow. That is what kind of fine-tuning of your quality of interpreting services is all about. When you identify candidates who are able to perform excellent in emergency departments or mental health settings, it's worth the effort to make sure that you reserve them for those situations. And certified interpreters are best candidates for this kind of high stake environments, since they have been tested, at least in CCHI's case, for simultaneous interpreting and for multiple situations during their written exam. As far as working conditions, several aspects need to be addressed. Well, definitely all interpreters, regardless whether they're certified or not certified, will perform better if they have adequate information about the assignments, if they have the opportunity at least to mentally prepare of what's coming their way. So make sure that that's in your procedures. Maintain optimal workload and pace. This is kind of common sense, but again, you keep your talent if the interpreters consider that their work is well paced and they're not working non-stop or are sent only to assignments that are not very valuable in their opinions. Debrief after sensitive assignments. At several national conferences in the last year, there were multiple presentations about interpreter self-care and emotional care, because as healthcare interpreters are exposed to a lot of trauma in various aspects, from end-of-life situations to mental health assignments to dealing with the assignments about different addictions or abuse. So it is important that in your company you have procedures or information in place of how interpreters could take care of their health and focus after sensitive assignments. Meet their IT or device needs. Modern interpreter is impossible without having a smartphone or tablet or some other ability to be connected during their assignments and while being able to prepare for them. So if we're looking at documenting performance, again, it's important to just establish procedure to document them. It's important that you do conduct the quality assurance elements like surveys, customer surveys, or internal checkups, or if it is a telephonic or remote video interpreting, that you have random you do record the converse interpretations and are able to go back to them. Because if you're never able to actually document something, then you cannot improve it. And as far as workforce development, I can offer 3 points here. First, it's important to offer support for interpreters to get training, either pre-certification or continuing education training. And what I mean by support are several things. It's things like having an opportunity for them to get internal training, or having an opportunity for them to go and attend conferences or local events, giving them time to prepare for certain things, giving them time for self-study, which is still paid by the company, and also obviously reimbursing them for their training expenses. So it's not always about money. As we all know, time is really more important. So if your interpreters are able to do some training on your time, on their hired or on the clock time, they will be definitely more loyal and appreciative, and that will show your commitment to the quality of their interpretation. Encourage teamwork, and here it is about establishing some internal procedures that allow interpreters to share their concerns, their questions, and their terminological finds. And so this is the type of conversation that you would want to hear among your employees versus the regular water cooler gossip. So let them gossip about how it's best to interpret cystourethrogram versus some other topics, right? And then encourage professional engagement. If you ask the question at different times during their employment, not just in the beginning, if they belong to any professional association, or if they attend conference, or if they volunteer for some professional entity, including CCHI in this case, that will show again indirectly that you are committed to quality, and by quality you have covered all the aspects that you can think of. So another poll, and what I would like to ask you now would be, do you have certified interpreters working with you? And I'm pretty sure we'll have some good answers here. So pretty much 3 answers possible: yes, no, or I am not sure. Okay, so what I see, let me just share that screen with you, is that we have 79% on the call today who have certified interpreters, 5% not, and 16% are not sure. So again, I'm very happy with these results, because that reflects the fact that we nationally have achieved the situation that certification is a factor in our industry. So let's talk about checking the next step in quality assurance process, about how do you do evaluation. So there's obviously many components, but I just want to point out 3: the internal monitoring of your quality, customers' input about the quality of your interpreting services, and self-assessment of interpreters of the quality of their interpretation. And when we talk about internal monitoring, there are many procedures that you can institute, but obviously you need to have random audit during actual interpreting, or conduct internal skills assessment. So during actual interpreting, if it's telephonic or video, that's very easy to do, since if you record your conversation, you can randomly pull the interpreters and just have them on a schedule. You have your 100 interpreters, 1,000 interpreters, put everyone on a schedule and do it once a year, twice a year, depending on how you feel about the current quality of your interpretation. If you are working face-to-face mainly, then it's important that you have some procedures of your quality assurance staff, or if you don't have anyone designated, then maybe senior interpreters or lead interpreters who shadow novice interpreters or interpreters with less experience. Have, again, a schedule how it's done. It doesn't have to be the full appointment, but if you don't have these procedures, you will really never know how the actual interpretation works, because all credentials, all degrees only mean that the person can do it in theory, but the practice is what's important for you and the reputation of your interpreting services. As far as internal skills assessment, again, if you have a quality assurance department or person designated to it, you can create various snippets of multiple choice tests, or have interpreters once a year interpret certain YouTube video. You record that interpretation and then have your either team evaluation of that recording, etc. Again, this is the opportunity for you to encourage teamwork, but also to know that each professional interpreter is responsible for delivering the high quality services, and you as their employer will be checking that, that it is not enough just to get certified, that this is only meaningful when they actually are delivering. Customers output, I'm assuming by this time, pretty much every agency has some kind of satisfaction surveys with their customers. If not, make sure that they are short and sweet and to the point. And what I found in my job is oftentimes people simply don't know who the interpreter was, who was nice. And sometimes they remember who was the interpreter who made some huge mistakes. But even then, I've heard some things like, oh, it's your cute looking girl who's, is this tall. Well, obviously, you need to design your customer satisfaction or feedback procedures that you can actually pinpoint any instances of high performance or low performance to a specific interpreter. And that's tricky, I know, but with the technology now, it could be done very quickly. So it will give you the third-party opinion of the interpreter's quality. It will not be the ruling opinion, because obviously you as the person from within the industry know more about the standards of interpreting than a customer would, but the perception is important as well. And you may have a wonderful, and I've had that in my experience, you'll have a wonderful qualified interpreter who is great at interpreting. However, their personal skills are not at the level that would be keeping the reputation of your company high. So you may have then work laid out for you to work on those aspects, more on customer service aspect versus the actual interpreting aspect. The self-assessment, I think sometimes we actually is overlooked oftentimes, but it's important that you create some self-assessment tools. It could be online questionnaires delivered to your interpreters via email, via their Facebook check-in. You can even offer some prizes. You get your $5 Starbucks card if you answer this survey, but put there the data which you previously identified as weak spots. And to give you an example, what could be a self-assessment, let's say you say, we expect all our interpreters to, when they interpret in emergency room, to be able to do simultaneous interpreting and to not interrupt the flow more than 3 times. Where are you on this continuum? Can you do simultaneous? If you do, can you do simultaneous interpreting? If the answer is yes, what would be the score you yourself assign from the 1 to 10, whatever it is that you want to do? And then speaking of these interruptions or clarifications during emergency room appointments, how often do you do it on general? So, and see what kind of results you get. Keep it on file in your interpreter's records so that they can historically then compare if there their performance is improving, or if at least if this tool will make them self-aware of the fact that, I've never even thought about this. I don't know if I am interrupting too often during emergency room or trauma ER appointments. So depending on what it is that you think is important for your company's reputation, or what is your niche, just those could be your self-assessment tools that will give the interpreters the idea of what it is that you want them to do and to improve. So after you conduct all these kinds of evaluation, obviously it's the time to act on your findings. And the findings could require many things, but one of them could be organizational adjustments. Then you may need to have some remedial actions because obviously if you only have, let's say, one interpreter who speaks CCHI and that interpreter failed all your evaluations, yeah, theoretically you can fire that interpreter, but I've been in business. I know the chances of you actually doing it, unless there is something tremendously critical, are very slim. So you may have to take the road of remedial actions towards that interpreter. At the same time, you still need to have your disciplinary actions policies and commendations, because it's important to keep things in perspective, and interpreters, as all of us, are more motivated by positive reinforcement than by negative reinforcement. But as a company, you have to have both. So if we talk about organizational adjustment, with having the data from your evaluations, you can go to your top management and say, hey, we need to allocate more funds to workforce development, and that includes training, certification, whatever else that you will need. You may decide that everyone needs to carry iPad or whatever it is, but it will be still workforce development. Consider changing focus. If your findings are such that you realize that no matter what you do, you still cannot provide performance that is satisfactory to the customers in certain language, or in certain specialty or subspecialty or modality. So you may have to say, hey guys, we can continue doing what we've been doing, but you'll continue getting the same number of complaints and ruining our reputation. Maybe we should refocus. Again, that's obviously not your decision as a quality assurance department, but it's your responsibility to bring it up to the attention of the top management so they can make informed decisions of the direction of where you're going. As far as remedial actions, it's important whenever you have any kinds of assessments of skills, or regardless, self-assessment or customer satisfaction evaluations, you need to provide feedback to your interpreters. And the feedback could be, well, during this year we have no comments from the customers, no good or bad. That means you're kind of in the middle. You may want to strive to be better, just because it's always better to have commendations than no news. So nobody notices you. But it could be, the other two options. Create improvement plan. It's important that if you during the evaluation stage you discover there are certain employees that are not meeting your quality requirements, that you involve them in the creation of the improvement plan, and they identify what are the weak areas, which areas they can work on within certain time frame. Obviously, be realistic, but it has to be a consensus building exercise, because that will also elevate their personal responsibility for the quality of interpreting services they are providing. Offer remedial training. If you notice that, let's say, your Russian interpreters are not doing good in certain situations or subspecialty appointments, or in general, then offer the Russian interpreter training for them. Yourself, hire somebody to come out, do it, pay for their online training, it doesn't matter, but that's something to think about. Pair those who perform less than acceptable or on the border with those who are your higher achievers, with the mentors, senior interpreters. And I obviously hope that those mentors and senior interpreters are certified interpreters, but I don't know that. You would be the one who will find out if that is the valid assumption. If we talk about disciplinary and commendation actions, you need to have disciplinary policy, which is clear, and enforce it. There are two extremes. One is that the policy exists, but nobody enforces it because you only have one interpreter with certain language and you don't want to lose them. Or the other one is the first strike you're out. We're all humans. We all are professionals. So the policy should be reasonable enough. And yes, there are situations when one strike is out, but those situations need to be defined. And usually they mean, severe damage to your company's reputation, severe, any kind of immediate risk to the patient's health, or non-compliance with the client's or hospital's requirements. But most of the times, that's not what we're dealing with. We're really more dealing with the situations when there are variations in performance that need to be addressed, and people can be given several chances. Develop commendation scale, and it could be anything from, hey, you will get extra time for your continuing education classes, or you'll be the next one we pay for to go to this conference. It could be pay scale, improvement to get your 25 cents or 2 cents more, depending on, which modality you're in. So that interpreters know that their efforts are recognized. And this kind of brings us to the question which, as you know, all interpreters are curious about, and that is about their payment. So what I'm asking you is, what is your position, meaning your company's position, your agency's position, regarding higher pay rate for certified interpreters? And your options are, we already pay higher rate to certified interpreters. We plan to pay higher rate to certified interpreters. We plan to pay higher rate for some languages soon. And we don't hire non-certified interpreters. Other factors apply. Yeah, because if everyone is already certified, just imagine in about 5 years from now, everyone is certified, then that will not become a pay differential. Then you'll have to think of some other ways that could encourage it. Like, hey, if you speak 2 languages, if you do simultaneous, if you volunteer for Greenpeace, I don't know. But certification may not become a factor. But being realistic, I think it'll take us at least 5 years to get there. Okay, I see we about half of people voted, but let me close the vote and I will share the results with you. So, actually, it is, I am impressed. When I go back to the interpreter conference, I'll definitely be very happy to share with them that 45%, at least of the representatives on the call now, already pay higher rate to certified interpreters. And then 36 plan to do it soon. I'm very happy to hear that it will not depend on the language, because, I agree with you, we're not at the stage where we could differentiate between certified interpreter of this language or that language yet. And then 18% don't hire non-certified interpreters. That is very, very impressive data, and I'm very glad that I learned it from you. So to recap the 4 steps of the quality assurance, if you plan in your and how does it correlate with our work at CCHI, is at the planning stage, you need to make sure that whenever you're working on your quality assurance plan, you know about national certifications and CCHI's requirements and initiatives. And that means you need to keep tabs on us, because we plan and implement different things continuously. When you implement the services, the easiest way to assure quality is to hire certified interpreters. And I want to point out the CoreCHI is as important as CHI, and I'll speak more about it in a second. Certify your currently employed interpreters with CCHI. When you do evaluations, provide for some way to compare the data about certified versus non-certified interpreters, because that is something valuable that you can contribute to the field to actually confirm that certification is of importance. Right now, we see its value, we assume its value, but only information from you and from the recipients of your services will actually confirm this. And then as far as acting is, when you get the findings about certified interpreters, either as a group of or specific language, please provide feedback to us. And or if you see that there are certain things that you think CCHI could do in addition to what it's doing, then share the ideas with us, because we want ultimately the same, which is quality interpreting services for patients and healthcare providers. So, since during the planning you need to know about CCHI, this is the part of the webinar where I'll talk about our certification program. So, as you know, the National Certification Commission for Healthcare Interpreters was created by interpreters for interpreters and the public good. That's our motto. And as of now, we have almost 2,000 certified certificates. We also administer accreditation of continuing education programs, and for a little over a year, and we're very happy that we have over 150 accredited programs right now with the CEAP. And last but not least is both of our certifications are accredited by a third party, the National Commission for Certifying Agencies, NCCA, the same entity that accredits certifications for healthcare professionals, computer science professionals, financial, architects, space, airspace. So many specialties are reviewed and then accredited by NCCA. So we're very proud that we were the first in the interpreting industry to get their accreditation. So what does our certification mean for you language service providers? Well, national means that it is accepted in any state, and you don't need to worry whether your interpreter meets the criteria for performing the services in a certain state, like you do with the court interpreters, for example, right? If you hire a court-certified interpreter by the state of Ohio, you will have to check with your local state whether they still need to do something else. Valid. Pretty much, our certification tells you if a person can interpret in healthcare settings in all modes of interpreting. In other words, our exams are comprehensive enough that they measure their ability to understand healthcare settings and how interactions are done there, and they are able to interpret in consecutive, simultaneous, and side translation modes. Credible means that it was created by interpreters and other industry stakeholders, and that means that it is not an academic exam. It is not an exam created by somebody who is not actually interpreting. So it is not a language assessment exam. This is the exam that is meant to perform the job of the interpreter. And vendor neutral, from the business perspective, simply put, it is we're not competing with you. No individual, organization, vendor, association, or entity has any financial or other stake in the program's creation or administration. In other words, if you allocate your dollars to pay for certification exam with CCHI, you know that those dollars are not going into the pockets of anybody else but CCHI, and the whole mission of CCHI is just to deliver as many exams as possible to healthcare interpreters in our country. So, what are the certifications? As you already, many of you know, because I see some familiar names there, is we have the CoreCHI certification and the language-specific CHI certifications. So the CoreCHI certification tests the core knowledge about healthcare interpreting, and it's available for interpreters of any language. CHI is language-specific performance certification in healthcare interpreting and is available in Spanish, Arabic, and Mandarin. A few comments about who is the certification for in general, regardless of whether it's core level or CHI level. In our definition, it is meant for entry-level interpreter, because in the healthcare settings where people's health and life are at stake, it's important that anyone entering the field is able to perform safely in that field. So we're looking not for masters in interpreting yet. We're looking for individuals who can perform interpreting in the minimally acceptable, safe manner. So And a person, for us, entry-level interpreter is a person who is able to perform these functions competently and independently in any healthcare setting. Now, entry-level in general means that the interpreter's knowledge of healthcare terminology is at the minimal acceptable entry level. That's what entry means. Entry level also means that the experience of a specific interpreter or their exposure to specific healthcare settings or situations have not been assessed. So we're not saying that this is the healthcare interpreter who could work in drug addiction rehabilitation programs or in trauma emergency rooms. That we're not testing. But we're assessing general level of their interpreting in any possible settings. However, entry level in certification means that interpreters' critical thinking ability are assessed and they are not at an entry level. We're not saying that the person who passes our exam can only make decisions and apply codes of ethics in these situations or not. No, this certification means that critical thinking abilities are what is required for any level. Same thing with the interpreting skills. Entry level does not mean that the interpreter can do some substandard interpreting. No. Interpreter, in my opinion and in our opinion, is a person who interprets everything accurately, completely, without adding, omitting anything, and taking into the account the cultural context of the communication. So with that said, if the person is not able to perform accurately, completely, etc., in consecutive, simultaneous, or side translation modes, then that person is not an interpreter. So the exam tests and measures their interpreting skills at the level that they are acceptable for any level of interpreting. So I just want to reiterate that so you're not mixing up the understanding of entry level with some kind of below quality interpreting. So CoreCHI certification is the professional entry point for interpreters regardless of the language in which they interpret. And it is a comprehensive 100-question, multiple choice, computer-based test in English. It's very important to recognize that there is actually at this time in our industry a huge value in the CoreCHI certification. Firstly, it distinguishes a healthcare interpreter from a bilingual because on the tests they measure their knowledge about safety precautions, universal protocols, and HIPAA. About working in health and healthcare various settings like health departments, hospitals, community outreach. And this is something that the person who simply speaks two languages is not able to know. Even a court interpreter will not know how to perform in healthcare settings unless they have studied and they have been tested about that. Also, and that's important for you as the employer of interpreters, is that CoreCHI measures critical thinking and ethical decision-making abilities that are vital for, obviously, patients, providers, but also for you because they're protecting your company's reputation and reducing your liability. Because if the person has the ability to apply an abstract concept of the codes of ethics to specific situations or scenarios described in the questions on our exam. That means that they're also able to assess how to act in those situations, but also means that, you know, if you're all familiar with the code of ethics for healthcare interpreters, that a lot of the times the correct decision for the interpreter is to contact their supervisor or inform their supervisor, or it's reported to the supervisor. So with that said, the interpreters who have been tested will know that recognize those situations and make sure that they check with you, their employer, before they act in any manner. So briefly, what the components are outside the critical thinking and decision-making abilities, which is built into the structure of the test. Manage An interpreted encounter up to 35% of the questions, and that's about their understanding of the code of ethics and standards of practice. Effective interaction with other healthcare professionals up to 24%, and that's important for you as a language service provider to a hospital, that you know how interpreters will be appropriately interacting with other healthcare professionals without offending them, without stepping outside their boundaries, and with preserving your reputation. Knowledge of medical terminology, up to 25% of questions. And again, the percentage is pretty low because in our field, the interpreters have the opportunity to clarify with the providers more often than in some other fields, but also healthcare providers are required to speak to any patient, including English-speaking patients, at a maximum sort of at 8th grade level, unless the patient elevates that level. So the language interpreters are exposed to is simple enough, and so on our exam we keep that level of complexity of the language. Ability to prepare for an encounter, up to 20% of the questions. Again, that is that critical skill to understand, are they qualified enough to do a good job and not to ruin your reputation. And cultural responsiveness, 6%, and that domain kind of speaks for itself. So I don't know how much you were exposed to CoreCHI, and I kind of gave you just a very brief overview of it, but I just am curious to see, what do you really think about the value of CoreCHI certification? And your options on this poll are, I see value in it, I'm not sure if it has value, and I don't see any value in it. I understand actually all 3 points of view because it is language neutral certification, but I want to check with you. Okay, we have about over 80% people who voted, so let me share the results with you. And once again, I'm really happy to talk to you today because 89% see the value in CoreCHI certification. That validates our work a lot and says that we are not doing something that is not needed for you and for the field. And 11% are not sure if it has value, and that's very understandable. And we need to do a better job of making it clear to the field, including hospitals and healthcare providers who request interpreter services. Now, briefly about our language-specific certification with CCHI, which is in Spanish, Arabic, and Mandarin. Those interpreters have to take 2 exams. First, they have to pass the CoreCHI multiple choice exam, and then they take the oral performance exam. And the oral performance exam, this is the place where their ability to actually interpret those 2 languages, English and Arabic, Spanish or Mandarin, are tested. So you get your assessment of their language skills that way. The main part of the exam, up to 75%, is interpreting in consecutive mode, then up to 15% in sight translation and written translation together. And the written translation is a small part of our exam because it was what the job task analysis showed us we have to do. And then up to 15% of the exam score is simultaneous interpreting skills. So the simultaneous interpreting skills is offered, the measuring of them and the testing of them is offered only by CCHI, and so I want to explain to you why we thought it is important. Well, first of all, in emergency departments, especially in trauma, when there are multiple professionals speaking English at the patient, it's important that interpreter is able to switch to simultaneous mode and do the to the best of their ability communication available for the patient or their family member if the patient is unconscious. Emotionally charged situations, those are broad, and any appointment could escalate from being neutral to being emotionally charged if the patient gets angry and they start yelling, if the patient gets upset or they gets start crying, because I guess again in those situations the interpreter has to be able to interpret simultaneously. That's how you get your customer satisfaction, that the interpreter is able to handle all situations and make it as smooth for both parties, patients and providers, to communicate as possible. And if the person can never do simultaneous, or if you have no idea if they can, then you put yourself at risk. And lastly, but not least, mental health. Um, Obviously, most of mental health does not require simultaneous interpreting. It is done in consecutive. But when you are dealing with psychotic patients, you will have to be able to interpret simultaneously. Otherwise, you are simply not delivering a service to the healthcare provider. Saying, oh, the patient makes no sense is not helpful and not an option if you want to provide quality interpreting services for mental health settings. So the value of CHI certification for you in those 3 languages that we offer it right now is that confidence in their skill level. That means that you can streamline your assignment scheduling. If you have your interpreter certified, you don't need to worry, should this person go to mental health, to emergency, to terminal illness counseling, genetic counseling. You just send any certified interpreter there because you know they're able to ascertain the difficulty and apply whatever interpreting mode is necessary. You also have the ability, if you have certified interpreters in CHI level, to assign certified interpreters to situations most likely involving simultaneous interpreting in other settings, administrative court hearings, or court hearings in general, immigration, especially if you don't have certified court interpreters in those languages or the same amount of them. Yes, healthcare interpreter certification by no means replaces court interpreter certifications. I'm not saying that, don't get me wrong. What I'm saying is that for you that could be, all right, I don't have a certified court interpreter available. I can give you a medical certified and have the customer decide if they will be okay with that, because at least you know that they can do interpreting at simultaneous level. And then obviously it saves you money on language proficiency testing. So you don't need to get your applicants or staff to test their language proficiency in Arabic, Mandarin, and Spanish if they already have certification, because you don't really care how they can speak in those languages. What you care about that they're able to interpret in healthcare settings. Where you can find information about certification or refer your colleagues, management, or interpreters on any page of CCHI's website, which is www.cchicertification.org. Click on the CCHI Community tab from the top, or in the footer, the first column, and select the second bullet which says Healthcare Interpreters, and you get to this landing page which has multiple links to all the information anybody needs to get certified. Also, we have a repository of resources which are related to passing the certification, but also in general are helpful for interpreters. So the quickest way is from the footer, the last bullet on the second column called Certification Resources. That's where the arrow is pointing. And you get to the landing page where you have multiple things, including study checklist. It's a one-page PDF documents with links on kind of organizing logically how you prepare for certification. CoreCHI study tips, again, interactive PDF where you can click on certain resources and make sure you read all the materials available to you. Practice test, it's a fee for service test where they can actually take the exam, which looks exactly like the CoreCHI written exam. Mini glossaries, this is our project where we involve volunteers to interpret mini glossaries on different subjects into multiple languages, and it's free for you or anybody to download and use. And medical terminology links. And I want to ask you, if you would like to share your resources and you think that you have a great resource that interpreters will benefit from, please do so. I'll be more than happy to include this in our webpage. So skill maintenance, that's kind of towards the end of our presentation. That's one of the things I want to make sure we address is, yes, passing a certification exam is important. However, interpreters, like any professionals that actually perform something, have the skills, they need to maintain them. And it's important for consumers because they guarantee the quality of interpreting. And by consumers, I mean both healthcare providers and patients. Because remember, we always serve both, two sides. For certificates themselves, CoreCHI or CHI, it's a requirement to keeping their certification. And here is another aspect of why CoreCHI certification is important, because even if the interpreter, let's say, of Burmese, Karen, Nepali, Kinyarwanda language has not been tested in the performance skills. The fact that they got CoreCHI certification means that they have to get continuing education, means that they will be attending the same events that your Spanish, Arabic, Mandarin interpreters will be attending by the same quality trainers. That means that they will improve their skills even if they haven't been tested yet, because they will be exposed to it and they have to do it to maintain their certification. For you, language companies, and for us, CCHI, it's an element of quality assurance because we have an obligation in front of the public and our accreditation body that we guarantee that the person who took the exam 10 years ago has the same skills as now, and we can prove it because they fulfill our maintenance requirements. So what are they? Both certifications are valid for 4 years. And the requirements that make your life easier, because you don't have to think about it, the interpreters are certified, they have to follow them, is continuing education, 32 hours within 4 years. But we make it even more applicable to our quality assurances. We break them down into 2-year periods because we really don't want to have an certified interpreter to sit the night before the certification expires and take online course for 32 hours. We want them to maintain their skills consistently. So at tier 2, they need to submit to us an application which says that they have 16 hours of continuing education. And then at tier 4, they need to submit an application which says that they had another 16 hours. And those two have to be different. I mean, 2 sets of 16 hours. We also require them 40 hours of work experience. Obviously, it doesn't really matter to you, but it matters for us because in some languages, there are not that many opportunities to actually interpret, and no continuing education will replace that ability to actually do and use your skills. So we require 20 hours each 2-year period. And then lastly, they need to be responsible, fill out the application on time, and submit the fees, and the cost is $150 per application, which is $300 total. They can pay it either at tier consecutively, tier 2 and then 4, or simultaneously, meaning fill out and submit everything and pay at once at tier 4. So this process that is designed obviously for our benefit, because we have the responsibility to confirm their skills, also benefits you because you can supplement it. You can provide those 16 hours to your interpreters free of charge, on nominal fees or whatever, but you don't have to say why it is important for them because they'll know why. And right now we do offer, as I mentioned quickly earlier, a continuing education accreditation program, which is the easiest way to make sure that your continuing education counts. The website is CEAP, You can also get to it from any page on our website. If you click that button on the right, the third blue button called Find an Accredited Training Provider, and you get to the screen where you can search by organization, etc. I know many language companies offer internal trainings, continuing education trainings, and we do accredit those. You have the option then to make the life easier for your employees or your contracted interpreters, but you also can open it up to the public if you have the ability or desire, and then more certified interpreters in your area could take your training, especially if this is an online training. To me, it's a no-brainer. If you have already internal online training, you may want to open it to others. The last thing to mention is just a couple of announcements. Many of you already know that we have an online registry of certified interpreters. This is how you can find it. We're working on doing the actual interface. So you'll, in a couple of months, you'll see it slightly differently. And then you can always verify if an applicant is certified or not by typing in their name. If the name does not appear, that may mean a couple of things, including the update to the website hasn't happened yet. They're timed, I think, in 48-hour segments. But anyway, always can email CCHI and we will check if it's important for you at that particular moment. I'm going to skip through a couple of slides here since we're getting towards the end of our presentation, but I want to just point out that how you can improve your quality assurance and support certification at the same time. The two aspects that supporting your interpreter's training is very important, either pre-certification or post-certification. Also, if you encourage your interpreters to subscribe to our newsletter, they will be more exposed to the news that certified interpreters are getting. Invite CCHI commissioners, staff to speak to your interpreters, either in person or via webinar. May certification a preferred requirement for new house. Reimburse a portion of the costs. Make it a loan. Make reimbursement or reward or a prize. You know, after annual assessments, if you meet this criteria, we'll pay for 50% of your certification or recertification fee. Make it a contest within your organization. But in other words, you know, show them that you really are caring about their credential and level of professionalism. You can also contact CCHI and see what special pricing we can have for you if you are sponsoring a group of interpreters to get certified. And lastly but not least, don't forget that as anybody else, we have real estate on the web and we're willing to rent it to you if you would like to advertise with us. Right now we have 2 trainers advertising on CCHI's website. You can see their banners. We also can provide a listing of your company in our newsletter. So there are various ways to advertise. We also have a donate button on our website like everybody else. So you can support us by donating either in general or to a specific cause, like creating some app which will be helpful for your interpreters or you specifically. We are not a 501c3, we're not a charity, so all donations to us would be your business expense, tax deductible, but not a charitable donation. Also want to point out where the green arrow is showing is that we do have a special place where we put different information and news specifically for language service providers. So if you click on that image, you will get to the landing page and more links which we think are helpful to you, and we always welcome suggestions on how we can make that section easier. And last thing I'm seriously saying now is like us on Facebook. I can tell you why is this is where you can post your job announcements, announcements about your interpreters becoming the interpreter of the year, and do all kind of things to have your name appear in front of the eyes of our community of certified interpreters. So with that, I would like to thank you for your attention today, and I will open the floor to questions. So I